Thank you for attending today's presentation, Improving Clinical Workflows, Insights from Galen College. Today's session is brought to you by PreCheck, Cisive's healthcare division. For more than 30 years, PreCheck has partnered with healthcare organizations to deliver background screening and credentialing solutions that help safeguard both patients and the workforce. We're excited to be joined by Galen College of Nursing, one of the nation's largest private nursing colleges, to share how our partnership helps streamline their clinical workflows. Together, we'll explore the challenges they face and the solutions implemented and the key takeaways you can apply within your organization. Also, please keep in mind that this presentation is intended for informational purposes only. Neither this presentation nor the material presented during the webinar should be construed as legal advice. Thanks again for joining us today. Without further ado, I'm excited to introduce our speakers, Dr. Audria Denker, Chief Experience Officer at Galen College of Nursing, Joe DeSanzo, Executive Vice President at PreCheck, and Matt Jaye, Vice President of StudentCheck, PreCheck student screening product. Dr. Denker, Joe, and Matt, please take it away.
All right, thank you, Antique, and thank you again, everyone, for sharing some time with us this afternoon. My name is Joe DeSanzo, and I'm the Executive Vice President here at PreCheck. And a big part of my role here is understanding the entire healthcare screening and credentialing journey for aspiring care providers, and then really looking at the associated workflows tied to that clinician's journey, whether that means reaching clinical compliance for your first rotation or the ongoing monitoring of their licenses throughout the duration of their employment. So as we look specifically at clinical rotation compliance today, the task really was how do we take this fragmented and manual process of background screening, drug screening, and immunization compliance, which is required for rotation, and leverage automation and integration to drive true business outcomes. And most importantly, along the way, we really challenged ourselves to put ourselves in the student's shoes so that we could deliver the most seamless experience possible. However, we have to accomplish these things while never losing sight of our true responsibility to ensuring patient safety, which requires the highest standard of care and operational excellence in all that we do, which we'll talk a little bit more about throughout today. So in a more succinct manner, I'll share some wisdom from Dr. Denker that I had from her in one of our first conversations. And that was, let's focus on letting nurses be nurses, administrators be administrators, and students be students. So as we thought about what would be most valuable for you all today, we really just wanted to share some behind the scenes. What did we find? The wins, the ahas, the challenges, how do we overcome those? And just have open dialogue with you all about how we can advance this journey together. So before I turn it over to Matt and Dr. Denker, I just want to share what an honor it's been to solution with such a thought leader and Dr. Denker, who invested so much time in not just challenging the status quo, but challenging us as a vendor partner to truly immerse ourselves to understand all three personas. So that said, without further ado, Matt, I will turn it over to you and Dr. Denker.
Thank you, Joe. Appreciate it and echo your sentiments, Dr. Denker. Joe and I have just been giddy about this presentation. We're so excited to have this just open conversation with you. And for the audience that's joined us just at a high level, what I have up on screen are a few of the things that we're going to be covering today. We really want to dig into the specific clinical placement challenges that Galen saw, how they implemented effective solutions to combat some of those challenges, and overall what the outcomes and lessons were that were learned. As Antique had mentioned earlier, we will have some time near the end for a Q&A session, but just in order to be as efficient as possible, as we're going through the presentation and this discussion, if there are questions that you think of, please feel free to type those into the chat, and Antique will be moderating throughout, and we'll be sure that we have time to cover those near the end. So, Dr. Denker, as we think about just what's going on right now and overall the challenges that are faced in the market with nursing supply and demand, these are really key issues affecting employers, affecting schools. And I think what's interesting from our perspective is that it really starts at Galen, right? When they first come into the program. And I'm just curious, from your lens, there's so many factors that are impacting this. Being that you see it firsthand, I'm curious to just hear your thoughts overall at how these can be addressed early on when students are first coming into programs like yours.
You've got this slide up here. I would be remiss if I didn't talk a little bit about the shortage of nursing and how it impacts what we do. And of course, we've got an aging workforce. lack of nurses overall, needing more nursing faculty and those type things. And so as an educator, we have to think about, we're obviously turning away a lot of applicants. How is it that we can streamline all of our processes, whether it's admitting the student, getting the student ready for clinicals, getting them into class or whatever? We have to streamline that process. And what we'll talk about further today is about how that you have to be very careful about the vendor and the partner that you select to help you combat all these different issues that you're facing. And we're going to talk today just about one. But in nursing education, there are a multitude of factors that affect us getting students in the program and ultimately out of the program, then to care for those patients that are in those hospital beds. And so I'm very excited to be here. I really appreciate y'all inviting me, and looking forward to us conversing about this over the next few minutes.
Likewise, thank you. Real quick, before we dive into the specifics of Galen, what we shared on the screen here, this is pretty startling, right? These are really kind of scary numbers that we look at when we're projecting what the imbalance is going to look like over the next few years. In general, outside of the systems and processes that we're going to talk about today, I'm curious to hear, what are you seeing being done to address these kind of issues, and are you optimistic about the future?
I'm very optimistic about the future. And as we get further into the conversation, some of the issues that we faced getting the students in was the processes that are put in place. And I think sometimes we're our own worst enemy. We throw up roadblocks for ourselves, and we have to start tearing those down. And all the information that I've seen, we've got to increase the supply and demand. And the NCSBN put out some information, and the nursing programs on average in 2024 grew by 10 students. And it's like, is that going to close that gap? Probably not. So we have to look at what are those obstacles that we have in getting the students in and getting students through the program. And what we're going to talk about here is one of the biggies. We're going to talk about clinical placement. We're going to talk about, the process that we have to go through. But we are going to face this challenge for quite a while now. And so that made my organization take a step back and go, are we doing everything that we need to efficiently, effectively, while creating a good experience for our students? And as you know by my title, Chief Experience Officer, that's what I'm focused on a lot, is what kind of experience is our student getting from not only coming into the college, going through that process, but the vendors that we use to help us get our students through this program.
I think that's a perfect segue, because Deloitte had actually published some data not that long ago, and this applies to nursing. This applies across the board, right, in all forms of business. But I think it's especially critical here for the very reasons that you mentioned, right? When you have poor systems, outdated technologies, things aren't talking to each other. It really is this triple threat for schools. We'll dive into that in a little bit more detail. And I'm really curious to hear from you direct on some of the bottlenecks that you saw, when you took on this challenge. Obviously, it's a big project, right? This is an enterprise system that we're talking about. You're across multiple states. You've got multiple campuses with different needs. To dive in and just talk about some of the bottlenecks that you all saw. Ultimately, I think it's about getting to the why behind this, and we'll dive in a little bit more on that as well. But would love to hear from you, and just your perspective on some of the things that we shared on screen here.
Yeah, and what you have on the screen is exactly what we face every day, is for us to grow by numbers and close that gap between what's going to be needed in nursing and what is the actual supply. We have to increase the number of students that we're getting into programs. There are a couple of limiting factors to grow in a program. You don't have to worry about curriculum, it's already there, but it's faculty and it's clinicals. Those are probably your most limiting factors to being able to grow a nursing program. And, through all of and there's a question up here, I think a poll up here is, how concerned are you with your scheduling and placement of your students? But what we're finding is that when we explore with our clinical partners, what we find is there's probably more clinical availability than what we know. And I know recently we were working with some clinical partners and school partners also to be able to fit all the students in. And what we found was there was weekend shifts not being utilized at all. Sometimes that's what you have to do. Sometimes you have to do off shifts. But what kind of led to this conversation that we're having today is that a lot of the processes that we had to do either for the school or for this clinical site was manual. And it's like, why are we doing all these manual processes? And referring back to your previous slide, we had fragmented systems that didn't talk to each other. We had issues because there wasn't enough human beings to physically input the data that we needed to input and make copies of immunizations and things like that. That really is where we saw the bottleneck up front that we had to solve for.
I think I'm sorry,
Go
Matt.
ahead, please.
You bring up a great point. You mentioned the manual work and you mentioned us asking why. That's such a simplistic way to approach it, but I just can't share enough how much we both learned. Our team went on site and sat in the shoes of the student and the Galen team. And as we asked ourselves, why are things this way? What we found it just was assumed that's the way it would be, right? And so as we started to really peel back, that's what we started to see, well, if we change this, and that's where some of the ahas went. So that was part of our takeaway. And this was, it's easy to say, well, the journey is as simple as background drug test immunization. But in that process with Dr. Denker and her team, it was so much more than that. And wondering, why are we doing it this way? It's leading to this bottleneck. So go ahead, Matt, I'm sorry.
No, I think that's a great point, Joe. And my mind kind of goes to, I think sometimes it's easy to get blinders on when you're stuck in an inefficient process, right? Because, hey, this is a pain, it's delaying X, Y, and Z. But when we talk about the real why behind this has pretty significant implications downstream, right? That could mean delayed placements for students, things like that. From your perspective, Dr. Denker, I'm curious to see, like, how are you all seeing that bubble up to a point where it became serious enough to take a look and say, we need to change some things around?
The seriousness came from, first of all, we had a lot of student complaints because we had them inputting information into 3 different systems. And they're like, can't we just enter it once? It's like when you go to the doctor's office, okay? And the nurse comes in and goes, what's wrong with you today? You say, oh, I got a sore throat. I've been running a fever. And then the nurse practitioner comes in, asks you the same question. And then the doctor comes in and asks you the same question. You're like, haven't I said this 3 times already? That's what our students were coming back to us with. It's like, why am I having to do all this work just to get through this program? And what we found was that the students were frustrated to the point that a lot of them did not get their clinical requirements in on time. And then there were items that we needed to provide our clinical partners, and we couldn't run a report to give it to them timely. We had to go through and dig through files or different documents online. And it's like, we can't continue to do this. We can't continue to burden our students with this, and we have to do something about it. Now, did we have a vendor that was handling our immunizations and background screenings, drug screening? Absolutely. We work with 5 scheduling softwares right now. We've got My Clinical Exchange, we've got Bridges, there is CCPS, we've got homegrown systems in some of our markets. And so it's like, oh my gosh. And each one of those systems required us to do different inputs and stuff. And what we did was we put the burden back on the student. Okay, you've got 3 different logons. You have to go in these 3 different systems. You need to upload your copy of your TB skin test 3 different times. And that was crazy. And frustrating to the point that students were like, do you want me here or not? And so we have to find solutions really quickly to help our students. And we don't want them to be frustrated. We want them to have a great experience. So that had us pause and go, what are we doing wrong here? And that's when you start searching for solutions.
It's really interesting as I hear you describe that, just to see the different, I think of it in my mind, it's like this painted picture of the splinter effect where this one thing happens and then it has, implications in 10 different areas. And you touched on a few of those, outside of the specific bottleneck for the students, we talked a little bit about just capacity being maxed out. There's not enough educators. So I always think about these sort of things as like, it's really truly a game of inches. And like every small area that you have the opportunity to improve upon just has a magnifying and cascading effect to the other areas of the org. And I think you articulated that so well in terms of y'all's experience. You brought up something interesting with regards to the rotation management systems, right? We all know, sure, folks in the audience today are probably shaking their heads saying, yeah, like we got that same issue, right? We're working with so many different vendors. I know we'll talk a little bit more about this in a second, but I'm curious just to hear, like, what was your experience like bringing different vendors to the table? And, obviously there's logistics complications that go into that. I think it might just be helpful for the audience to hear a little bit about how you guys navigated those waters.
When we were searching for solutions to all the issues that we had identified, the first thing that you do is, we ask our vendors, would you help? And can you help us solve these issues? And surprisingly, it wasn't that easy to find organizations and partners who want to sit down and listen to you and say, okay, what is your biggest challenge? We may be able to fix it for you. And that was one of the things. I also want to mention that there were other issues that we were identifying. For example, and I'm sure no educator out here has ever experienced this. I'm being facetious, of course, but students were starting to falsify even the documents that they uploaded prior to going to clinical. One of our students had uploaded a CPR card that she just evidently kept changing the date on. And with computers now, you can do all kinds of beautiful stuff with documents and things. And our vendor was not catching those things. And so it wasn't just about some of these bottlenecks and stuff. It was also about the quality of what you're getting from your vendor partner. And are they willing to sit down with you at the table and say, let's solve this together? And I'm sure, I've got right now 25 different campuses. We have 18,000 students. And so I don't have time to run around and try to fix all this by myself. And that's why when we started our due diligence process of who are we going to work with? How are we going to fix this? We had to find somebody that was just as invested in the solution as we were. And so that had to be the criteria before we decided to go with a vendor partner.
I'm glad you brought up the fraudulent document issue. That's one of the things that we hear about. The other thing we'll often hear about is just the severity and the implications if a criminal conviction's missed. We talked a little bit about the beginning of the conversation, like, why do we do all of this? Sometimes I think it can seem like a necessary evil and we can get the administrative blinders on. But the reality of it is we do this for patient safety, right? It's not just to check a box. And Joe and I have had this conversation numerous times. Joe's got a young daughter, and when she was born, you got a lot of lab coats in the room, and I don't want to steal Joe's thunder, so I'll let him share a little bit in terms of the story behind that and just the why it's so important to us.
Yeah, Matt, thank you. And she's 3 years old and now my boss. Her name is Madden. But so I've been doing background screening for 20 years now, and so I ask the questions as my wife's giving birth. Of course, I would ask who's a doctor and who's a student. But it was very eye-opening, right? They all had the same patient access to my wife and my daughter. And there were 6 blue coats in there. And when I asked that, it was a 3-3 split, right? And it really hit home when I mentioned earlier our responsibility. We are doing the background check and giving access to those patients. And that is such an important part of this. When we think about folks falsifying, even missed records, right? Things like that. Those are the unsung heroes, if you will. We sometimes get so caught up in the process, the automation, and all those things are super important. But those things really do impact outcome and are the core of why we do what we do. right? So it's really important. Going back just a second as well, something Dr. Denker said, as we looked at this process and these bottlenecks, and we really started to pull back. Sometimes I think we assume that the students know what background checks are, right? We all deal with this in this setting, right, all the time. Students don't. So uploading these different immunizations, the background's kind of simple, the drug, right, simple to them, but the overall process was really challenging. And what we found was not just in consolidating those systems, but the instructions, right?
Mm-hmm.
What can we do proactively to reduce those bottlenecks, right? So as we hear the frustrations from the Galen team of everything they were dealing with, it was that stems back to the student. That stems back to the student being confused. So those were the things I'm sure a lot of you are experiencing as well. Those were my ahas, right? As we really started to peel back that when administrators say, this is painful, I feel like I'm managing the process. When we started to peel that back, that was the aha for us of, let's really just simplify this for the student because everybody's life is a little better off afterwards, right?
Right.
So just thought that was a really important takeaway for us.
I totally agree with everything you're saying. And, I call it the backpack syndrome. You have one little thing happen, you throw it in your backpack. I'm not going to say anything. And then another little thing happens. And it doesn't matter if you're at school or in the grocery store or whatever. But at some point, your backpack is so big of these little nuances and aggravations that it kind of breaks the camel's back, so to speak. And so that's why, as much burden and obstacles that we could remove from the student, that was one of our goals. And I think that was one thing when we sat down and started our conversations with one another. It's like, what is your goal and what is my goal? And those two aligned. And so that's what makes a partnership, is when you and I are both rowing the boat in the same direction to solve the same problem. And I'm being honest that not every vendor that we've worked with has felt that way. And again, we don't want to put anything on the student that we don't have to. They have enough stress in their life, being moms, dads, working, doing homework, coming to school, all that kind of stuff. We all have that as well. But if you can just take one little thing off their plate, it just makes it so much better.
Couldn't agree more. I think that's a great segue too into just the implementation process. Just through the course of our conversation, we get so excited about this stuff. We probably got ahead of this a little bit, but I think it is so important. And one of the things that stood out to me just early on in the conversations that we've had with folks from your team is meeting the students where they are, right? When we all went to school, it was a different world. You're right. Even 10 years ago, it was a different world. Technology's advanced so much. I mean, I can speak from experience. I've got a 20-year-old and a 17-year-old. And if everything's being done by email, guess what? They're not reading it. Like, it's crowded. And when we worked with Tim Frederick specifically, your head registrar, I think he said this so poignantly that we wanted to include it in here. When compliance fails, everyone is at risk. The students at risk, the patients at risk, the facility, the school itself. And it's really, in your role as chief experience officer, making that experience better, right? Removing friction for the student leads to these types of outcomes where there's an improvement across the board. And you touched on a few things earlier, right? The falsified records, the missed background check details. I just can't underline and underscore this enough, how severe these things are, right? You can speak from experience that it has reputational impact. The worst thing that could happen is you lose a contract with a clinical partner, and it's just such a competitive environment out there right now. Curious from your experience, since you all went through the implementation process with us, if you were to call out, one or two key highlights that really were difference makers for y'all, what would you say those have been?
Well, first and foremost, and to speak to the risks that we see here, when we sign that clinical contract with the facility, we're basically saying that thank you for entrusting us with your patients while we're there, and that everything that you've asked of us, we're going to do. We're a guest in their home. When we go over there with our students, we're a guest in their home. They're allowing us to come in. And we have to have trust in that the data and the information that we store and that we provide to the facilities is accurate. And when we did the manual process, we were making all kinds of mistakes, because it was hard to point out falsification of something. And also, depending on where you go and get your titer for your measles and rubella or whatever, the documents that the hospital or the doctor's office gives you, they all look different. And it's like, so how is it that we make sure that when we're sending our students into the facility, which they've allowed us to come into as a guest, how do we assure them that we're on top of all these things? And that was probably the biggest piece initially, was just making sure that quality and the accuracy of the information that we were providing was as 100% is what we're shooting for. A lot of times we were finding documents sliding through the system and not being caught. And then for some reason, a hospital calls you and needs copies of documents, and you're like, oh my gosh, this student has falsified this record. And so that's when we decided, yeah, we have to migrate. We need to find a vendor partner that's going to be as crazy over quality and accuracy as we are. In nursing, you can't afford to make a mistake. We have to work towards perfection, because if I give a patient a wrong medicine, it could kill them. And we definitely don't want our students going into a facility taking care of vulnerable patients, newborn, people on chemo, and possibly exposing them to a life-threatening disease. And so that was the first, I think, level of angst. I mean, our student experience was definitely, but we had to make sure that whoever we aligned with was just as aggressive towards accuracy and the compliance of it as we were. And of course, when we sat down at the table, when you all talked about what were your goals here, it was aligned. It was the same thing. And we can ill afford to have one of our students go into a clinical facility and not make sure that all those boxes are checked.
I think you make a great point as well. So, that's the back end of the compliance. A big piece of this that I felt we worked on together as well is making sure we had the reporting correct, so that you could give your partners that confidence that, hey, while we're guests, we understand that the students we place are absolute direct representation of your brand. And that was a lot of work with the Galen team of making sure, right, there's CAN reporting, and then it was, how do we make sure we're getting you the reporting you need so that you can message appropriately to your partners? So that part, could you talk a little bit about that and what that journey looked like, Dr. Denker?
Yeah, again, being a partner in this, with StudentCheck, it was sitting down saying what we needed. And I can almost guarantee you that if there's a report that I need, probably every other nursing program in the country needs that same report at some point in time. And so I just have to say, when you sit at the table, you want people sitting across from you that want to find a way to get to yes. And so that's what we did. We sat down and we experimented and we tried things, and until we got the process and the output correct. And again, we've got to make sure that the information is accurate. But the one thing that we had a concern about was the fact that not only did our students have to enter their immunizations and things over here, it wasn't getting to the system, the scheduling system over here. And the team said, well, let's work on that. Let's develop APIs that will dump the information into the system so that you nor the student has to re-enter that. And, we've been told no a lot. That's just not what we do. It's going to cost you thousands and thousands of dollars for us to build some interface and all that. And that wasn't the conversation at all here. It was, again, how can we get to yes? How can we solve this problem together? And it not only We got more accurate data. We have more trust in the results that we're getting, that our students aren't complaining anymore because you all made the platform intuitive. And I remember one platform that we used before, we had to make our own videos showing students how to get into the system and upload their information because it was so convoluted. And it's like, no, it should be only a couple of clicks. And so, because not everybody, we have a lot of older adults coming to school now, and they're not as tech savvy as the kid that lives off their iPhone and can do their homework on it and everything. And the students were struggling with that. And it's like, how do we make it simple? I always say, KISS, keep it simple, silly. How can we get, make everything more streamlined than what it is? And again, we had students that had to drop. Here's the other thing I failed to mention earlier: the time it takes to review the documents. We had students being dropped from the program because their documents that they uploaded took a week or so to get validated by the background screening and the compliance checker. And this student didn't have 7 days. And so, what do you do? And that's the other thing. I think the timeliness, and we talked about what is the turnaround time that you all need to get your students in through the system. And it was never, oh, I'm sorry, our policy's 7 days and that's it, and you all have to live with it. And that solution just didn't work for us because we are on a quarter system. And so the turnaround time between quarters is sometimes less than a week. Sometimes we got 2 or 3 weeks, which is great. But because of that quarter system, and you all were willing to work with us on that because we needed our student information turned around faster. And to me, that was kind of what sealed the deal for me, is that you didn't push back on the problems that we were presenting as an issue.
Yeah, it was actually a fun journey looking at, Matt had mentioned the communications. It was not just the turnaround time, right? And the integration, it was how are we and where are we communicating, right? Yes. Email a few years ago was how you communicated with candidates very effectively. That's not what today's state is. So we know that text is a more efficient option, but then it was when and where in the process are we sending these reminders, again, to avoid those. So yeah, that was definitely a fun part of the process for sure. Uncovering those easy takeaways, if you will.
Absolutely. And figuring out what's the best way to communicate, and stuff. And we have several ways to communicate with the student. And a lot of them don't even read their Galen email. You have to send it to their home email or text them and say, hey, your TB is expiring in 2 weeks. You better get on that. And, when I've talked to students on the phone, when they have an expired TB or something else, they'll say, well, I never even checked my Galen email. Why would I even look at that? And you don't even think about those things. So where can we put it on the student's portal? Can we send them text messages? Is there other ways to communicate? And by doing that, I may prefer email. You may prefer a text message. Somebody else may prefer a phone call. And we've got to make sure that how we're communicating, we're using multiple modalities to let these students know, because at the end of the day, I don't want anybody to have to drop out of school because their TB skin test expired. And it was happening.
You shared just so much great information there. I was like feverishly writing down some notes. One of the things that kind of pops in my head is the immunization tracking process. That tends to be like the most complex of everything. And you touched on one key point, right? You have to be able to reduce the amount of time it takes to review those records. But on top of that, it has to be done with 100% accuracy. And a lot of what we were seeing was like students would get approved who shouldn't have been, or vice versa. And then that extends the process even longer. The other thing that you brought up that I think is important is, whether it's a falsification of a record or students saying, I didn't get that, is having things like activity logs, right? Where if you have to make a difficult decision, right? We're empathetic by nature. We want to give folks the benefit of the doubt, but it's kind of like trust but verify. And if they said that they didn't get it, and we can look in an activity log and say, well, actually, that was opened on September 10th at 1:33 p.m. I think that helps to support those difficult decisions that your team has to make.
Absolutely.
The other thing I was just kind of thinking about, and I'll preface this with, I'm asking this because I think it's going to be for the benefit of the audience that we have here today, right? Obviously, Galen is a large, multi-state, multi-program enterprise organization. There's a lot of things that you needed to do to get a program like this in place. And just from our personal experience, we'll talk to programs pretty frequently. And I love the backpack analogy. I'm going to steal that. Their backpacks are really, really full, but it kind of falls in the state of inertia where until that backpack's so full they fall backwards off the mountain, stuff doesn't get done. Anecdotally, if you had a piece of advice for folks that might be evaluating some of the things that you were considering, is there anything that stands out in terms of these are the low-hanging fruit that I would look at and maybe look to improve upon?
First and foremost, when you're having an issue that you're trying to solve for, you got to understand where your current system is breaking down. And then, we actually tracked the student. We created like a flow chart that showed the student through the process of just entering their immunizations into, a compliance tracker platform. And it was very complicated. And so when we started looking for solutions, and you have to, again, have somebody that's going to sit with you and have the vision of decreasing those touch points, simplifying the system, as you do. And unfortunately, not every organization is willing to do that. And we have a lot of skin in the game with these students, and they're trusting us to give them a great education. My daughter's a student here, and she came here because she goes, Mom, I've seen your all's pass rates. You all are a great organization. The nurses who go there that I talk to love it and stuff. We don't want anything, the experience wise, to be negative that would deter a student from continuing on in their nursing education. I don't care where they're at, any school or whatever, because of the headaches that can be caused by ineffective, inefficient processes. And so you have to look at everything, but before you come to the table, you have to understand where your problems are. Where do I have issues? Maybe compliance is not an issue, but the problem is that the facilities that I want to go to, they just don't have space for me. That's when you have to stop for a minute, have a really honest conversation, and figure out what are the alternatives that we have here. And I think that's, where we clicked a lot. I mean, it was like we were all in the same family when we first started meeting. These are my long lost brothers that I didn't know I had. And it's because that you cared as much about my issue as I did. And that's the difference. And I don't care what system, whether it's your student information management system, your enrollment system, even your LMS, I don't care. But you need somebody to work with that's going to care as much about your problem as you do. And I think that's what we found. And it was literally sitting around the table with this whole litany of problems and bottlenecks and stuff, and going, okay, let's figure out how to fix this thing. We'll write this one over here. We'll put this on the parking lot because we need to think about this later. And again, you have to have a clinical partner. Otherwise, how right now, and we have thousands of clinical rotations going on right now across the country. We deliver about 1 million hours of clinicals every quarter. Okay. That's staggering. Okay. I can't manually do that many hours. You have to make sure that your systems are sound, that there is the checkpoints that you need, that not only are you doing compliance check-ins or trust but verify, if you will, but you guys are doing it too. And that was I think the difference maker, and coming to the table and solving the problems. And there was some great, I think, suggestions that came from both sides. And you're like, you know what? I'm going to write that down, because we're going to do that for every partner that we, join with. And we did the same thing. It's again, it's the joint ownership of not only the problem, but the solution that will solve that. And I don't care if it's with your, your background vendor, your compliance tracker, or the hospital that you work with. You have to go in there and say, there's an issue that every time we show up on 2 South, there's another clinical group there already. How can we make this situation to where that, I'm not always having to move my students? It's as simple as that. But the other thing I think about when it came to solving our problems is the fact that we are doing a lot of things with my clinical exchange, but it wasn't just that scheduling platform that you're like, we'll work with anybody that you work with. That was the other thing, because again, the most accurate information is setting right now in the PreCheck StudentCheck system, and we needed to get to this other platform, and we're not the techie people to figure that out. That's you guys. And you are like, you know what? We'll sit at the table with anybody you all have business with, and we'll help solve this issue.
That collaboration was so helpful. Oh, sorry, Joe, go ahead.
No, I was just going to say it's so true. And we often, throughout this journey, and we challenge ourselves as an organization is the future platform of our space is no platform, right? Because you all live in your systems. And so that was the task, is how do we get the background, the drug, the immunization, not just in a seamless experience up front for the student, but then how do we get those results into the system of record, real time, so that everybody is efficient. So that part was actually really fun to start to map, because to your point, Dr. Denker, we were at the table with my clinical exchange as well. And it was such in a large complex program, it's easy to think of what all can go wrong. We really fleshed those things out ahead of time as a unified group, and just focused on what if this all goes right. And that was such an awesome experience throughout the journey. And like I said, even learning throughout. So that part, I would encourage everyone, if you don't feel that your process is seamless, it can be. And we took fragmented processes and drove that efficiency. And the implementation could have been very daunting. One thing I think is important to add is the different workflows, right? What do we do with students in transition, and right, the go forward students? So looking at those different buckets and not just assuming, hey, we're going live on this date. It's how do we methodically go live and make sure your program has continuity throughout.
And I think the other thing that you guys kind of brought to the table also is, after the student graduates from us and then they go to work for a healthcare facility, is there some of that stuff that can flow over with them so they don't have to repeat that process when they get hired? And while that's not fully baked yet, we're trying to think of the life cycle of the student, not only from when they walk in the door, but all the way through when they are employed, and how can we share information with the employer? And to me, that innovation and that forward thinkingness is where we have to be in society. I mean, we're living in the age of AI now, right? But definitely, I think that is what was so enlightening going through this, is not just sitting down with you guys. And I'm glad you mentioned it. We sat down with other vendor partners saying, we have to use this system because this is what the system that the city uses here, or the community, or whatever. We'll also work with this system over here. And again, getting that, how do we get to yes in all these situations?
Absolutely.
Gosh, our time is flying by here.
Yes.
And I'm absolutely loving this conversation. I am going to jump ahead just a little bit because I want to make sure we have some time for questions from the audience. I think this is kind of a full circle moment for us, right? Like, you shared so much great information, Dr. Denker, the partnership, the collaboration. I mean, those have all been key to getting you the outcomes that you needed, that your team needed, that your students needed. Definitely last but not least. And I think that comes back to what Joe talked about earlier and what you've shared, right? Let's let the nurses be nurses, right? Let them care for the patients. They're not, nor should they be, background check experts. Administrators, we get that a big portion of this burden tends to fall on their shoulders, but how do we make it easier for them? How do we give them the ability to do more with less? And students, right? You mentioned this a moment ago, And I think this is why our organizations are so aligned, because we can sit shoulder to shoulder and really have these deep conversations and think about what's the ultimate goal here. Going back to the shortages we talked about at the beginning of the conversation, what if we could develop systems that employers get their eyes on these students earlier on in the process? I almost think about it like Major League Baseball, right? They recruit from high school. Like if you could find your 5-star talent that's coming up through the ranks 4 years ahead of time, what would that mean for your talent pipeline as an employer later on and as a school, right? Like you're looking at NCLEX pass rates, you're looking at job placement rates. What would that mean for you? So, just if you have any closing thoughts on this, I'd love to hear it. And then we can spend the next 10 minutes with questions.
Yeah. The only thing I will say is, and the reason why I made that statement about letting students be students, letting nurses be nurses, is our president and chief academic officer, Tracy Ortelli, always says, if it doesn't take a master's degree in nursing to do the job, they shouldn't be doing it. And what I saw when I looked around is I saw our administrator, our nurses basically doing a job that didn't require their level of expertise, nor were they experts at it. And so, again, it frees up that administration to be able to do what they need to do. We need to be spending more time with the students, hearing their feedback and that kind of stuff, and less time sitting in an office uploading documents. That's really just a waste of our time. And so that's what I appreciate, is that we were able to change how we can integrate with our students and talk to them more and be with them more by streamlining our processes.
Well said, Dr. Denker. I think that's a great place to leave off. I'm going to turn things back over to Antique. He's been moderating some of the questions that have come through, and excited to hear what's on the thoughts of the audience.
Yes, so we do have a few questions that came in. One is, how did you handle migrating existing students over when you switched vendors?
We can talk a little bit about it from our perspective, but maybe just it'll be helpful to give context, right? So when we think, the way I interpret that question is, you're a large program. You had tens of thousands of students, and you make a shift to another vendor. Going to the example of the healthcare records, right? The immunization records. It's not necessarily just flipping a switch and saying, okay, now it's all going to be done by PreCheck. There was a migration process of getting that existing population of students over, and some orchestrating that needed to be done to make that work. So would love to hear from your perspective how that flowed for you, any challenges, maybe things that you hadn't thought of beforehand that might be helpful.
Yeah, I think, we didn't want to, the students pay for their own background checks and stuff, and we didn't want to have to charge the students for a secondary system. And so we had to just pick a date. We just picked a date and said, okay, from here forward, we're going to use the new system. What you all did was you came to the table and said, let us help you get the information from the old system over to the new, so that we weren't working out of several different platforms at the same time. So the transition was very simple. Turning it on, it's very intuitive for the student to walk through it. And so it was pretty seamless.
Thank you.
All right, so here's another question for Matt or Joe. Can StudentCheck integrate with other systems?
Go ahead, Matt.
Yeah, so 100%. The way that I would think about this is, there's going to be some systems that are pre-integrated, meaning the integration's already been built. My Clinical Exchange is a great example of that. We have the ability to connect directly into their system, and that can be turned on fairly quickly. Because we have an open API, we have the ability to integrate with any platform. So as long as there's a willingness on the other side, Dr. Denker spoke at length about this, so I won't go too in depth in that, but yeah, 100% we have the ability to do that.
Next question, with regard to communication, would it be possible to send a text message to the student advising them to check their Galen email for an important update regarding compliance?
Yeah, so the message within whatever message we send can be customized. So yes, that piece, as far as what directions we send them or where we send them or link them, that is all customizable.
Does StudentCheck integrate with Oracle?
So we do have the capability through the open API. It's just not pre-integrated. As an organization, though, we are an Oracle preferred partner. Linking those two in StudentCheck wouldn't be very difficult.
Is AceMap not pre-configured?
As of right now, no, but we do have the ability to connect with them through the API.
Next question. We use ADB for immunization records, background checks, etc., and then AceMap for clinical coordination. Both charge the students fees. For ADB to communicate with AceMap, they charge another fee. Does StudentCheck charge these fees?
We don't, no. So all of the integrations that we do for StudentCheck, we don't charge a fee for. It's absorbed as a cost of doing business. We also recognize that a lot of the schools we work with, I'd probably say 90% plus, it's student pay. And the schools just don't have the financial resources to pay for that. And frankly, we just don't think it's fair to pass that on to the student.
Question. Our nursing program uses AceMap system. Is this used nationwide?
StudentCheck, yeah, absolutely. We work thousands of programs across the entire United States.
Mhm.
All right, we have one more question. How did you align? This is maybe for Dr. Denker. How did you align with your vendors and clinical partners when setting a program of this scale up at Galen?
Again, you have to get everybody around the table so that everybody understands, what each vendor's doing. And again, we started working with PreCheck because our biggest challenge was the reporting. Of course, the students getting their stuff in the system was challenging, but reporting and the systems talking to each other. And I'd been promised multiple times that, oh, we'll get the information over there and stuff, and it just wasn't happening. And so we sat down at the table with the student scheduling software or whatever the clinical partners are using. Doesn't matter which platform it was. You have to get everybody around the table to figure out how this is going to work. And again, we have to eliminate duplicate processes in anything we do in life. You don't want to drive to the grocery store twice. You don't want to go get milk and then come home and then go get bread. No, you get the milk and bread together. And so that's where I think that you have to have these key stakeholders all sitting at the table at the same time. And we even had our clinical partners sitting at the table as well, working through that with us so that the communication between all the entities was streamlined.
Thank you for joining us today. Dr. Denker, I would like to thank you for being with us and providing us with such an informative and timely presentation. To learn more about our student screening solutions, you scan the QR code on the screen right now. Thanks again for joining us and have a great rest of your day, everyone.